Hi, I'm Dr. Jordan Metzl, and we're going to talk right now about an achy shoulder. Now, who gets shoulder pain? Well, definitely triathletes get it, sometimes runners get it, and an achy shoulder is really something you want to get checked out and try and figure out what the problem is. Now, everybody's heard about rotator cuff muscles, and you may have heard of that if you're a baseball fan. Baseball pitchers get rotator cuff tendonitis all the time, but swimmers get it all the time too. The rotator cuff muscles are small muscles that sit in between the shoulder joint. The shoulder joint's like a ball and socket joint, just like this, and it moves. And the rotator cuff muscles come right over the top. And if the muscles supporting the shoulder joint aren't strong enough, the rotator cuff muscles tend to see too much loading force and they get very sore. That's called rotator cuff tendonitis. Why do I tell you this? Because if your shoulder's achy, many people say just stop using your shoulder and the pain will go away. So if you're doing a lot of swimming yardage for your upcoming Ironman and your shoulder's starting to get achy, your coach may say, let's pull you out of the pool. But the biggest issue is you want to make sure you strengthen all the muscles around the shoulder to lessen the load on the rotator cuff. Stopping your swimming will take the pain away for a short period of time. But if you're not careful and if you don't keep strengthening around it, it'll just come back the next time you start swimming again. So the key thing for shoulder pain, particularly this rotator cuff tendonitis, and you'll know you're getting that if when you come in your overhead stroke, when you get your arm up in here in your stroke, if it starts to pinch up in there, that's called impingement, and that's the classic person with rotator cuff tendonitis. When I put my shirt on in the morning, when I get my hand overhead for my stroke, it starts to hurt. If you're getting that, the key thing for you is to get in the gym and start doing your seated rows, pulling, doing a lot of scapular strength. If that doesn't help, then it's time to go to a doctor for sure. You want to get this shoulder checked out. We get x-rays of the shoulder. Those are helpful to look for arthritis, and if there's no arthritis, we get an MRI to look for a little tear in the rotator cuff called rotator cuff tendonitis. Now, there are other things that can show up on MRI too, things such as a labrum tear. That's the cartilage that sits inside the shoulder joint, and that can be torn also. That'll show up on an MRI as well. But the main things with shoulder pain are generally in triathletes, and sometimes in runners too. They tend to be from not being strong enough around the shoulder. And so you want to make sure you're doing all your seated row, all the scapular strengthening, the muscles in the back of the shoulder. That's the key to a happy shoulder. And if you can do those strengthening exercises to start with, that should help your shoulder pain a lot.